Hi, I'm Dr. Messina, and today we're going to discuss hypopigmentation, a discoloration in the skin secondary to a decrease in melanin production. Hypopigmentation could be very variable, presenting as simply a slight lightening of your coloration to something as profound as an area of skin completely devoid of pigment, leaving behind a white patch. We're going to be discussing a specific type of hypopigmentation secondary to laser therapy, and scars. We're not going to be discussing vitiligo or idiopathic hypopigmentation where you suddenly develop a hypopigmented area for no reason at all. Those should be treated by a dermatologist because they might have a medical cause. In other words, you might have a fungal infection, or you might have an autoimmune disorder. And depending on how well received this video is, I might do a video on vitiligo because the diagnosis and treatment is a little different than hypopigmentation secondary to laser therapy. The lasers most commonly associated with hypopigmentation tend to be the lasers that seek a pigment. So your Q-switch lasers and your picosecond lasers for tattoo removal. They'll seek a pigment and they'll shatter it. So if it shatters your melanocyte or traumatizes your melanocyte, that melanocyte will probably stop putting out melanin, and you'll start to develop an area where you lose skin pigmentation. Now, if it goes for over a year, that might signal the death of the melanocyte, and the odds are it's probably not going to improve. If you simply stun your melanocyte, over time, usually somewhere between a year and a half, you'll start to repigment that area slowly. Other lasers that are implicated are hair removal lasers, long pulse lasers, intense pulse light systems. So how can we try to avoid creating a hypopigmented situation? Well, one thing is to use a laser fluence or laser energy that's compatible with the skin type, and to give plenty of time to heal in between treatments, specifically when we're talking about tattoo removal. If you have a darker complexion, time is your friend, and at least 12 weeks in between treatments. Laser hair removal, you don't really have that much leeway. It tends to be about a month apart. So with that, it's more important to be careful with the amount of fluence you're using with each treatment. I think it's very important for patients to fully understand whatever treatment they're getting into. There are treatments for hypopigmentation. And if you look on the internet, you're going to find many websites with these glorious before and after photographs where you're going to see a patch of light-colored skin. And then the after photograph, beautifully repigmented, you can't even tell. Unfortunately, that's the rarity. It's not the norm. The norm is either you don't repigment at all, or you repigment with little islands of repigmentation, usually around hair follicles. And then it might fill it in, but more often than not, you're going to have little white edges. So you're going to have kind of a geographic look on that skin. Patches of repigmentation, areas that aren't pigmented. Of course, once in a while, you will get someone who completely repigments. But like I said earlier, that is not the norm. So it's important to know that the results are going to be very tenuous. You might not get the greatest results, but it's still worth trying. So if you have hypopigmentation, what can we do about it? Well, the first thing to do is to stop the insult. So let's say you're getting laser tattoo removal and you're developing areas of hypopigmentation. I would recommend stopping for a while and allowing the area to heal. If you don't want to stop and you still want to proceed, then go at a lower laser fluence or a lower laser energy. The next thing you can do is expose it to the sun But there's a caveat with that. Remember, sun exposure is going to increase your risk of developing skin malignancies. So it's really not the smartest thing to do. But if you wanted to expose it to the sun and see if you could re-stimulate the melanocytes, you can. But you have to be very careful with it. You don't want to go into the sun and create a big sunburn. And you don't want to create a situation where you've hyperpigmented the area. The next thing you could do, which is relatively inexpensive, is start using tretinoin or retin-a. Retin-a increases cellular turnover, and it has the potential to stimulate the melanocytes and possibly repigment an area or help repigment an area. 5-FU, which is really a chemotherapeutic agent, might help stimulate melanocytes. However, if you go that route, I would highly recommend going to a dermatologist. And then we have the lasers, specifically the excimer laser, which has been shown to increase melanin production. And again, you'll probably have to go to a dermatologist for that, because the excimer laser is really kind of a one-trick pony. It's good for stimulating melanocytes, and you're not going to find it at your local spa. And then finally, using narrow band light therapy. The 308 nanometer light has been shown to help repigment, specifically for vitiligo, but it can also help repigment hypopigmentation secondary to lasers. As I said earlier, the results could be very variable. Also, it depends on what area of the body. Areas of the body that have a lot more hair follicles respond much better than areas of the body that don't have hair follicles, such as the fingers and the back of the hand. So let's discuss hypopigmentation from surgical trauma, such as a white scar. Again, these therapies might help that. You might want to use a fractionated CO2 laser to resurface the scar, maybe get it a little flatter. But the whiteness is going to be difficult to get out. And we always heal by scars. You can try the previous methods, but if they don't work, you can also seek a plastic surgeon to do a scar revision. We always heal with the scar. However, a plastic surgeon uses techniques to kind of hide the scar from the naked eye. I hope this video was informative to you. If you like it, remember, click subscribe for more of these medical education videos on cosmetics and medical topics. Take care, have a good day, and I'll see you at the next video.